welcome you all, and today we will discuss about the peritonitis. Peritonitis is what? It is an inflammation of the peritoneum. So the inflammation of the peritoneum is called peritonitis. Now it can be primary and secondary. Primary is when it occurs spontaneously, sudden, spontaneously in adults and in children. So the inflammation of the peritoneum can occur spontaneously in children or adults. So this is primary. Secondary is when the reason is in abdominal. Abdominal source is the reason. Any abdominal source. Now this abdominal source could be first reason is the diseases like appendicitis, cholecystitis, or Meckel's diverticulum, or the ulcers. Ulcers could be the duodenal ulcers, gastric ulcers, or colonic ulcers. And the peritonitis can be followed by after the operation. So that is the post-operative peritonitis. So this generally occurs after the surgery, and this could be due to the improper instruments, not sterile instruments. If the instruments are not properly sterilized, so or could be the reason like during the operation if any foreign body gets enter into the body. So the post-operative peritonitis could be due to the foreign body, presence of foreign body in the peritoneum, or because of the use of improper sterile instruments. Then peritonitis, this secondary peritonitis could be after the pregnancy or delivery. That is known as parturition peritonitis. That is after the delivery or the pregnancy, after the delivery. Then there could be any injuries, intra-abdominal injuries in the abdomen that can also lead or can trigger the peritonitis. Other reasons are infections. So there could be infections of gram-negative bacteria. Gram-negative organisms. These are Klebsiella, Proteus, and E. coli. Then usually these gram-negative organisms, Klebsiella, Proteus, and E. coli stays in large and small bowels. Then there could be infection due to aerobic and anaerobic bacteria like streptococci. So aerobic and anaerobic streptococci, that could be also reason, and the bacteriotes stays in lower intestine. Now what happens? This bacteriotes which are staying in lower intestine and the gram-negative organisms like Klebsiella, Proteus, and E. coli, and aerobic and anaerobic streptococci, or the organisms outside of the abdominal wall or outside of the peritoneum. So this can lead to the peritonitis. Now how the peritonitis occur? As this bacteria, this gram-negative bacteria and aerobic and anaerobic streptococci. This lives and grows in the fluid of the peritoneum. So because this fluid is rich in proteins, in toxins, so that's why this bacteria grow and multiply in the fluid of the peritoneum. Now what will happen? This peritoneum secretes lot of fluid, and so that will result in third space fluid loss. So that will result in hypovolemic shock. Hypovolemic shock. And this bacteria secrete endotoxins. So the endotoxins will cause endotoxins secreted from the bacteria will cause septic shock or endotoxic shock. So this is the pathology, how the third space volume gets depleted and hypovolemic shock occurs, and the bacteria secrete endotoxins that result in septic shock. Now the clinical features. In clinical features, first is abdominal pain. Severe abdominal pain that is cutting in nature. Severe abdominal pain that is cutting in nature, violent severe pain, and the patient will get relief only on lying down position. Slightest of the movement will increase the pain. So movement will increase the pain. Then the second reason is because it is a infection and inflammation of peritoneum. So there will be fever with chills, rigors, body ache, muscle ache, fatigue. So general features of infection. There will be persistent vomitings. Why? Because of the irritation of the peritoneum. Because the peritoneum, parietal peritoneum is getting irritated and inflammation. So that will cause persistent vomitings. Then there is abdominal rigidity and guardedity. Rigidity and guardedity. Abdominal rigidity and guardedity. Persistent vomitings with fever, chills and rigors accompanied with fatigue. Then there will be distension of the abdomen. Why? Because there will be accumulation of fluid. Fluid is increasing in the peritoneum that results in distension. So there will be no vowel sound. No vowel sound here. So there will be no vowel sounds. Then the two signs you have to remember: rebound tenderness and cuff tenderness. Now what happens in this? In cuff tenderness, the pain will be elicited in all the quadrants of the abdomen. This is cuff tenderness. So the pain will be elicited in all the quadrants of the abdomen. This signifies what? It signifies the sensitivity of the parietal peritoneum. In rebound tenderness, when you will apply the pressure on the abdomen, and when you will relieve the pressure, then the intensity of the pain will increase on relieving the pressure. So that signifies that there is inflammation in the abdomen. Then the very important symptom is Hippocratic phase. Hippocratic phase. Now what happens here? Hippocratic phases. then pale and pinched face, then cold perspiration on the head, hollow bright eyes, hollow and bright eyes, and along with that, yes, cold perspiration, blue cracked tongue, pale and pinched face, and tachycardia, that is increased pulse rate. So there will be cold perspiration on the head with blue and cracked tongue. The face will be pale and pinched with hollow bright eyes, and tachycardia will be marked along with the fever and persistent vomitings with abdominal rigidity and guardedity. So these were the features. Now investigations. You will recommend patient for the blood test. So there will be in CBC, there will be WBC increased because it is an infection, so leukocytosis. Also the neutrophil count. Neutrophil count will be increased. So beside this, you will recommend patient for X-ray. In X-ray, there will be gas under the diaphragm, and also there will be glass ground appearance. Glass ground appearance. This indicates what? The accumulation of the fluid in the peritoneum. Glass ground appearance will be noticed in X-ray. Then ultrasonography. And the very important investigation done in case of peritonitis is four-quadrant abdominal tear. Four-quadrant abdominal tear. So what happens in four-quadrant abdominal tear? Aspiration is done from the peritoneal cavity. So what happens in the aspiration? If the pus comes, that indicates the infection of bacteria, gram-negative bacteria. And if the bile aspiration comes, that indicates the biliary peritonitis of gallbladder, or the perforation of the duodenal ulcer, or the gangrene of the intestine. So if the bile comes in aspiration, that indicates biliary peritonitis of the gallbladder, or the perforation of the duodenal ulcer, or the perforation of the intestine. And if the blood comes in aspiration, that indicates hemoperitoneum. That indicates hemoperitoneum. So four-quadrant abdominal tear is done by taking the aspiration of the content from the peritoneum. These were the investigations. Now in treatment, just remember the treatment by ABCD. ABCD, E, F. So in A, aspiration with Riles. Aspiration with Riles. So because there is too much fluid in the peritoneum, that is resulting in distension of the abdomen, and third space volume has reduced, that resulted in hypovolemic shock. And because it depends on the four-quadrant abdominal tap test, that what content is inside the peritoneum. Is it pus? Is it blood? If blood, then it indicates hemoperitoneum. If it is pus, that indicates infection of the peritoneum. And if it is a bile content, then it indicates the perforation of the gallbladder or the intestine. So aspiration is done with the Riles tube. Then bowel care and blood is arranged. Because yes, I forget to mention, in investigation also recommend patient for the blood and urine and blood sugar levels, because it is very necessary each type of diseases, especially the infective diseases, because if the fever has increased, we have to investigate the blood and sugar, blood and urine sugar levels to identify whether the patient is having high sugar levels. So then we will give insulin in the treatment. So if the sugar levels are high, so in treatment first give the insulin to normalize the blood sugars of the patient and arrange the blood if blood is needed. Take care of the bowel. Then in C, chart maintenance. What you have to do, just maintain and keep the record of all the vitals. The respiratory rate, pulse rate, the temperature rate. Just check out all these things and maintain, because this should be stabilized during the process of surgery. Then in D, give the drugs, antibiotics. That antibiotics cover both aerobic and anaerobic organisms. Usually cephalosporins are given. Cephalosporins are given. Or the antibiotic which cover both the aerobic and anaerobic. Then in E, give the do the exploratory laparotomy. So what is done after the exploratory laparotomy? The bowel or the peritoneum is washed properly, or the peritoneum toilet or peritoneum wash is done with the saline. So this is very mandatory. Then F, fluids, intravenous fluids are given. So in treatment you have to remember these things by the A, B, C, D, E, F.